that they need to inherit. Alright, so limited characteristic as if they cannot perform like the other person. Okay, which are normal. Alright, so you should know what is disability because it has many parts of it. You have mental disability, physical disability, cognitive disability. Alright, so etiological part of it you should know. What is etiology? Like what you said just now, causes. Okay, you want to know what is the causes of this. Alright, sometimes you can't just know what is the causes. Even doctors can't actually identify. So how do we identify? By evidence based. Okay, how to prevent? That's all they can say for a disabled person. Okay, how to get it lesser the impact of treatment. Okay, they cannot change it to be normal again. If a person is disabled, you cannot change it to be normal again. But you can actually make it minimize kind of thing. Alright? So based on evidence based. That's all they can do. Alright? So you have many characteristics or factors for disabilities. Alright, these are the key factors. Okay. Okay. So basically you have mental disability, physical disability, and cognitive disability, like what I said just now. Alright? Give me some mental disability. Some examples for mental disability.
Louder.
Yes. Mental disability. Some examples of mental disability. Same. Anyone else would like to try? Bipolar. Alright. You guys? Depression. Mental disability. Okay. Anyone else? Anxiety. What else? There's a lot of mental disability nowadays. Okay, bipolar, yeah, she said. Okay, all right. Physical disabilities. What are physical disabilities? Basically, whatever you can see, right? Like impairment, your visual, your hearing, all right, and physical, all right, that you cannot perform like the normal person. All right, that's physical disability. What is the cognitive disability? What are those? Autism. Autism is the best example that you can actually get. Okay? Thinking, learning, slow, syndrome Down. Alright? These are cognitive disability. So, 3 disabilities. Okay? Alright? So, these 3 models are actually overview of what I said just now, evidence based of how they get the factors and how to treat a patient. Okay, first is the medical model, second will be the social model, third will be the biopsychosocial model. These 3 models they will use actually to treat. Alright, so genetic, epigenetic factor of disability. Okay, first of all, in your brain. Last time, if you remember, I brought the model, right? I brought the model of the brain. Okay, let's see. I actually have it here. Just a picture. Alright. Okay, so this is the human brain model. Okay, and the chemical part of the brain. Alright, so the first part of it, okay, parietal lobe. Parietal lobe is actually giving you disability because of balance. Okay, you can't balance yourself, or disability caused by balance from your parietal lobe. Okay, and then you also have the frontal. Frontal will be the memorizing, thinking, learning. Okay, if a patient is having autism because of the frontal. Okay, occipital of course your eyes. Okay, occipital is your eyes. Okay, you cannot see your, you have impairment of visual impairment, then it is because of the occipital lobe. Okay, temporal lobe will be your hearing, auditory. Alright, your hearing part of it. Okay, and you also have cerebral function, which is connected to your all the system. Okay, the nerve system. So your brain connected to the nerve system is cerebral function. Okay, so because of that, if you have syndrome Down or things like that, it's because of the cerebral function. Alright, so you need to know how disability happens first. Okay, it's all because of the brain disability. That means there is something not functioning well throughout the brain part of it. Alright. Okay, so what is the role of genetic? This is because of genetic. Alright, when you have a person, that's one factor of it. Okay, genetical factor. Okay, so from the beginning, okay, the patient has certain disabilities. It's because of the genetic. Okay, epigenetic environment and the development of the disability happens. Alright, when can you detect this? When a baby born, okay, if it's because of genetic epigenetic factor, when can you detect it? As soon as the baby born, you can detect. Can? Huh? Not sure? Can you detect as soon as baby born? Oh, this baby has something wrong with this baby. Can you detect that? Can. Certain can. Syndrome Down nowadays can. Autism also can. Okay, even before the baby born, you can actually detect. Alright? Certain cannot throughout the genetic and epigenetic. So, usually detection will be after 8 months. Okay? After 8 months, you can see some difference in the baby. Okay, like the baby cannot talk, or that one is further more. It's not 8 months. Alright? So, you have to observe the baby. That is genetic and epigenetic. Okay? Different type of genetic mutation can also cause the disability. Mutation. Alright? Why mutation happens? Why mutation happens? Why mutation happens? Sometimes the mother might be smoking or alcohol or that kind of thing, will actually have certain mutation. Alright? And also environmental factors. Okay? Too much of stress. Okay? Too much of stress when the mother is working and also studying or whatever it is, too much of stress, so it will affect the baby. Okay? That's why disability, babies, you must also look at the parents. Okay? Why? Evidence-based, when I say medical model, is actually looking at all these factors. Okay? Alright. Prenatal, perinatal, exposure to toxin, okay, traumatic injury, right? All of these can cause disability. Okay, you can see why disability happens. It's all based on the evidence. Okay, what is evidence? When we have cases, we report the cases, right? So based on read everything and then come out with your way to solve the problem. What you call this in research? Case study? Can? Can. You're asking me can? What do you call this in research? Describe this case study.
Well, it's different mothers have different type of like immune systems, so they may have like when they're pregnant, they have like a different situation towards their baby. So this is case by case, whether their baby will have disabilities or not, or in what kind large samples, or you have a database already there, so you can just use it.
You should have a database if you want to do it fast. If you don't have a database, then you have to go through many cases until each and every result that you are getting based on certain cases is saturated. No more different kind of interpretation by doctors. Then you can stop. You can take those cases. Okay, that's how you do case study. But for FYP, I don't think so. Case study is a good way of doing your research. Okay, you have to go very detailed if you are doing case study. Okay, the other part of it is environmental factor, which is like infection. When you have the risk for the disability. Okay. Also, with the genetic part of it, an epigenetic factor. Okay. Other than that, of course, maybe in some other countries they will have these factors as part of it. The poverty, okay, and things like that might affect disabilities for the children, and also the community impact. Okay, might also impact as an excessive barrier for the healthcare that the parents cannot provide, or the pregnant mother cannot have, right, before they can give birth, right? So all of these prevention strategies should be addressed before you know what is the cause of the disability. Okay, before you can conclude what is the cause of the disability. Of course, when a child is disabled, parents will start to ask, or the mother will start to ask the doctor, why? What happened? What did I do? Right? So the doctor has to do all of this before they can conclude why. Okay, even that might not be exactly 100% correct. Alright? Okay, so you need to address all the contribution factor, and also, of course, counseling, screening. How do you know what is the parents or the mother's habit? Okay, before this happens. So you should screen. You should talk to the parents. Okay, what happened? Are you in stress? What kind of work you are doing? Right? So they will have certain interviews or short session with the parents to know what is the reason. Maybe the mother is working on the father. The father has a very less contribution to disabilities mother. Alright? If the mother is working in an environmental area which has a lot of industry, the toxic and things like that, can also be part of it. Alright? So emotional part is also the aspect. Unique need and strength has to be given to the parents, okay, to motivate the child. Right? So this is how you handle. Okay, handling is another part. I'm just talking about the etiology. Handling disabled kids is another part of it, where you need a lot of patience, okay, to handle it. Alright? So the different role of person will be in the kids part of their life. Okay, first maybe with the educators, okay, the caregiver. Sometimes parents will just leave it to the caregiver to actually take care of the child. Okay, throughout the system, whatever the system is, the child has to grow up. Okay, whatever it is, the child will grow up. In that manner, the parents